Okay, now they are telling us question 10. Which of the following below are criteria for psychosis? Bizarre behavior. That's A. Abnormal experience. B. Lack of insight. If you guys have done psychology, you notice that all of this that has been listed here is those are symptoms or those are traits that you find with psychosis. That's why I just said people should look for what is psychosis. So D is the right answer to that question. Right. D is the right answer to that question. All of the above, right? Question 11. Patient sees lock on the nurse's head and takes them for snake in an image. In an example, or it's an example of right. A patient sees lock on the nurse's head and takes them for snake is an example of A. Hallucination, B. Illusion, D. Delusion. Delusion. That's C. Delusion. D. Delirium. Right? Seeing something else and then attributing it to another. It's an illusion, right? That's an illusion. If you guys have done psychology, you find that very, very easy to answer. Which of the following is an example of a neurotic disease? Neurotic disease, a disease that affects the neurons, right? A neurotic disease, or not even neurons, something that a psychological disorder, right? That has something to do with how your composure is, how you behave, how your attitudes are towards external and internal stimulus. Psychosis, not really. Psychosis, not really. Schizophrenia occur as a result of, how can I put it? Like we have catatonic schizophrenia. The person behaves like an M-Beza. The person is not able to retain any memory. The person is somehow, it affects everything about the person. Then we have bipolar disorder. The only answer, bipolar disorder, is far from it, right? It's far from it. You see that this particular year, they brought questions from psychology much. So the only answer there is anxiety. That is, it pushes us to that, right? The next question. Irrational fear is known as irrational fear. A. Phobia. B. Obsessive compulsive disorder. C. PTSD. That's past traumatic stress disease. D. Somatoform disorder. The irrational fear is phobia, right? Phobia, and there are of many types, right? We have gamophobia and all of that. There are some people who cannot stand in public and talk. They're just afraid of public space. So it's another type of fear. Fear of animals, fear of snakes. Now, question 14. Which of the following sound is most likely to be heard on auscultation in a child with pulmonary pneumonia? Pulmonary pneumonia. Most often at time, children with pulmonary pneumonia, they experience A. Tremors, B. Raunchy, C. Crackers, D. Whistling. Children with pulmonary pneumonia at times, that is the main sound that you always get from them. The main thing that I always get from them is crackers. Crackers. Why crackers? Crackers because there's so much fluid accumulation at the level of the alveolus, and the child is trying to breathe with that fluid, and then it's blocking the airway. It's blocking the airway at the level of the bronchi and all of that. And so it makes him, it's not even whistling. Whistling is like, it occur when, whistling may occur when there's difficulty in breathing, like in the case of asthma. But it's rare to find such in pulmonary pneumonia. Though the person normally in pulmonary pneumonia, the person also experiences difficulties in breathing, but the main sound upon auscultation is always crackles, not whistling. You may experience whistling in rare cases, but it's not the primary thing. Which Which treatment option is best for patient diagnosed with inflammation of the lungs? All right, inflammation of the lungs. A. Nitroglycerin. B. Thoracentesis. C. Corticosteroid treatment. D. Thoracotomy. The right to reduce inflammation in the lungs. Corticosteroids, right? Corticosteroids is the best option for that because it reduces inflammation. All the other options have nothing to do with that. You are a nurse who works in a hypertensive clinic taking care of patients with high blood pressure. What can you say is the most common symptom of high blood pressure? The most common symptom of high blood pressure, we have fast heartbeat, we have high blood temperature, high body temperature. C, that's fatigue, and D, it has no symptom. Like I said, these questions they are aimed at distracting you, right? Questions are also aimed at distracting you. Fast heartbeat. Now, the most principal symptom that you face with patients that have hypertension, there are two questions, there are two answers there. We have A and C, right? Heartbeat, fast heartbeat, and B and C, fatigue. Now, fatigue always results as a result of limited blood supply to various primary organs of the body. And because of limited blood supply to these primary organs of the body, it leads to tiredness. The organs become exhausted. And when these organs become exhausted, the only way it manifests in the body is by fatigue. And you and I know that during hypertension, the pathophysiology of hypertension makes us to understand that the lumen of the blood vessel is reduced, and when it's reduced, limited blood flow goes to the various organs of the body. The heart may necessarily not pump blood faster in most cases, although some cases the heart may pump blood faster, but in this case, most of the time, you may have a normal heart rate for patients that are hypertensive, but the primary symptom they always find with them is fatigue. So now you look at this, that's one of the symptoms that we have for hypertension, right? Fatigue. And so if you want to develop a nursing care plan from here, you can also develop from the symptom fatigue. So because nurses draw their nursing care, their diagnosis from symptoms, why doctors do their own diagnosis from the laboratory and from symptoms, right? Question 17. Which during your community free walk, you come across an individual with a swollen leg, with a skin looking thick and brown and people purple like. It also has fluid draining from it. The major cause is a filaria 1. What will you suspect? Cellulitis, right? When you see the skin is thick, cellulitis doesn't present with that. Cellulitis, elephantiasis, let's look at that, leishmaniasis, and filariasis, right? The right answer to that question is going to be elephantiasis. Why? Because of the fact that we have said the legs, swollen legs. You may, in cellulitis, a particular portion of the body, not all the legs may be swollen, a particular part will be swollen, not all. 18. Right. Which of the following is the most common cause of peptic ulcer disease? Which of the following is the most common cause of peptic ulcer disease? Chronic alcohol injection, stress-related mucosal damage. C. Helicobacter pylorus infection. That is right. Question 19. Which of the following is a complication of peptic ulcer disease? Which of the following is a complication of peptic ulcer disease? Gastrointestinal bleeding. That's A. Gastrointestinal bleeding. B. Perforation. C. Obstruction, and D. All of the above. Which of the following is a complication of peptic ulcer disease? The first thing you need to understand is complication. You also experience gastrointestinal bleeding, right? Because you may have a dark stool, melena, right? And then perforation, you can also experience that with peptic ulcer disease. Obstruction, you can also experience that with peptic ulcer disease. So the right answer is going to be D. All of the above is correct. Now, question 20. A 45-year-old man comes to the hospital complaining of rectal bleeding. Itches will cause discharge and pain. And itches will cause discharge and pain on defecation. It sometimes occur with anal protrusion, right? With anal protrusion. When the anus or the rectal region becomes itchy, person goes to defecate, the person feel pain, and then it with some watery discharges or some mild watery discharges upon defecation, or the person feel pain during defecation, or the person has bright red blood during defecation. A. Rectal carcinoma. B. Hemorrhoid. C. Anal fission. D. Rectal erosion. You say the right answer to that question is going to be hemorrhoid, because those are primary symptoms that you always find with people suffering from hemorrhoid. Then question 21. When we say a burn is of partial thickness, what when we say a burn is of partial thickness, what does it mean? When we say a burn is of partial thickness, what do we mean? A. It involves only the dermis. B. It involves all of the skin. C. It involves the epidermis only. Then D. All of the above.